Hello and welcome. Today, we're diving deep into a condition often overlooked in discussions about sensory impairments: cochlear nerve degeneration. This disorder, affecting the very pathway that transmits sound to our brain, can have devastating consequences on hearing. Join us as we explore its intricacies, from its causes to potential treatments. So, what triggers this degeneration of the cochlear nerve? The etiology of cochlear nerve degeneration is often multifactorial, meaning it can arise from a complex interplay of various factors. Age-related hearing loss, also known as presbycusis, is a significant contributor. Genetic predisposition can also play a role, making some individuals more susceptible. Exposure to ototoxic drugs, certain infections like meningitis or mumps, autoimmune disorders, and even physical trauma to the head can all contribute to damage and subsequent degeneration of the cochlear nerve. In some cases, the cause remains unknown, categorized as idiopathic. To understand the impact of cochlear nerve degeneration, we need to understand the pathophysiology. The cochlear nerve, a branch of the vestibulocochlear nerve, is responsible for transmitting auditory information from the inner ear to the brain. Specifically, hair cells within the cochlea convert sound vibrations into electrical signals. These signals then travel along the cochlear nerve fibers to the auditory cortex in the brain, where they are interpreted as sound. In cochlear nerve degeneration, these nerve fibers progressively deteriorate. This degeneration reduces the number of signals reaching the brain, leading to hearing loss and impaired sound processing. The severity of the degeneration directly correlates with the extent of hearing loss and the difficulty individuals experience in understanding speech, especially in noisy environments. Loss of myelin sheath around the nerve fibers, a process called demyelination, may also be present. Pinpointing the exact prevalence of cochlear nerve degeneration is challenging, as it is often intertwined with other forms of hearing loss, particularly age-related hearing loss. However, it's understood that the incidence increases with age. Studies suggest that a significant portion of individuals diagnosed with sensorineural hearing loss may exhibit some degree of cochlear nerve degeneration. Determining the exact numbers remains a focus of ongoing research, especially as diagnostic techniques become more refined. The signs and symptoms of cochlear nerve degeneration can vary depending on the severity and progression of the condition. The most common symptom is a gradual and progressive hearing loss, often affecting high frequencies first. Individuals may experience difficulty understanding speech, especially in noisy environments. Tinnitus, or ringing in the ears, is another common symptom. Some individuals may also experience dizziness or balance problems, although these are less common and might indicate involvement of the vestibular portion of the vestibulocochlear nerve. A key feature is often disproportionately poor speech understanding compared to what would be expected based on the pure tone audiogram. This means that despite having relatively good hearing thresholds, individuals struggle significantly to comprehend spoken words. Diagnosing cochlear nerve degeneration involves a comprehensive audiological evaluation. This typically includes a pure tone audiogram to assess hearing thresholds at different frequencies. Speech audiometry is performed to evaluate speech understanding abilities. More advanced tests like auditory brainstem response, ABR testing, can help assess the function of the cochlear nerve itself. In ABR, electrodes are placed on the scalp to record the electrical activity of the auditory nerve and brainstem in response to auditory stimuli. Magnetic resonance imaging (MRI) may also be used to rule out other conditions, such as acoustic neuromas, which can also affect the cochlear nerve. A key diagnostic indicator is often a discrepancy between the audiogram results and speech understanding abilities, suggesting that the nerve is not transmitting signals efficiently even when hearing thresholds appear relatively normal. While there isn't a universally accepted classification system specifically for cochlear nerve degeneration, it can be categorized based on the severity of hearing loss: mild, moderate, severe, profound, and the degree of speech understanding impairment. Some researchers also classify it based on the underlying cause, such as age-related, noise-induced, or genetic. However, a more precise classification system that incorporates the specific pattern of nerve degeneration observed through advanced imaging or electrophysiological testing would be beneficial for tailoring treatment strategies and predicting prognosis. Currently, there is no cure for cochlear nerve degeneration, but there are several treatment and management options available to help individuals manage their hearing loss and improve their quality of life. Hearing aids can amplify sounds and improve audibility, but their effectiveness depends on the degree of nerve degeneration. In cases of severe to profound hearing loss, cochlear implants may be an option. Cochlear implants bypass the damaged cochlear nerve and directly stimulate the auditory nerve fibers, allowing individuals to perceive sound. Auditory rehabilitation including speech therapy and communication strategies training, can also help individuals improve their communication skills and adapt to their hearing loss. Furthermore, managing underlying conditions, such as autoimmune disorders or infections, is crucial to prevent further nerve damage. While completely preventing cochlear nerve degeneration is not always possible, several measures can be taken to reduce the risk. Protecting your ears from loud noise exposure is crucial. Using earplugs or earmuffs in noisy environments can help prevent noise-induced hearing loss. Avoiding or carefully monitoring the use of ototoxic medications, when possible, can also help protect the cochlear nerve. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and managing underlying health conditions like diabetes and hypertension, can also contribute to overall ear health. Early detection and management of hearing loss can also help slow down the progression of nerve degeneration. The prognosis for individuals with cochlear nerve degeneration varies depending on the severity of the condition and the individual's response to treatment. While hearing loss is typically progressive, the rate of progression can vary significantly. Early diagnosis and intervention can help slow down the progression and improve outcomes. Ongoing research is focused on developing new therapies to protect and regenerate the cochlear nerve. Some promising areas of research include gene therapy, stem cell therapy, and the use of neuroprotective agents. These therapies aim to repair damaged nerve cells and restore hearing function. Furthermore, advances in cochlear implant technology, such as improved electrode designs and signal processing strategies, are continuously improving the outcomes for individuals with severe to profound hearing loss due to cochlear nerve degeneration.